Hello everyone. Today is September the 10th. I'm Dr. Adam London, Director of the Kent County Health Department, here for this week's update. Right now we're standing at 8,083 diagnosed cases of COVID-19 in Kent County, still seeing an average of about 40 new cases every day. Our positivity rate, that percentage of tests that come back positive for COVID-19, has actually dropped a bit again since last week. Last week we were at about 2.4%, now we're back down below 2%. We're at 1.9% as a rolling average over the past 7 days. So that's very encouraging to us, especially as schools are restarting and the weather is changing. We know these are risk factors for the transmission of COVID-19, and so we're very excited to see that our number of positivity remains very low. And right now we're at 161 deaths here in Kent County, which I believe is the same number I reported last week. So we're very thankful that our hospitals continue to do such a great job in keeping good outcomes for COVID patients and making sure that we're not seeing the same sort of mortality that other places have seen. Now, speaking of schools and universities, you may have seen in the news that some schools and some universities are having difficulty with the number of cases with school starting in the past few weeks. We've been doing the investigations of many of those cases, and I want you to know that what we're finding in general is that these cases are not being caused through spread in the classroom. Very few of the cases that we've investigated are actually linked, we believe, very few are linked to classroom transmission. Far and away, the most common reason these cases and these outbreaks are happening is because of social gatherings and events outside of the classroom. The sort of gatherings and parties and students coming together. And we understand that everyone wants to get together, and there is this desire for, especially for students, to socialize and have fun. But right now, it's a very difficult time for that. And we're seeing many of these outbreaks are linked to those sorts of gatherings. So we really want to encourage our young people to please be careful, be mindful of this. We want to continue to urge people to wear masks, socially distance, and disinfect, have proper hygiene, hand washing. If we do those things, we believe we can keep transmission of COVID-19 low, and we can keep our schools operating. We can keep face-to-face instruction happening in our schools and in our communities. So just really want to encourage all of the young people out there to please follow that guidance, and all of us to please think about that so we can continue education going in as many ways as possible, including face-to-face instruction. A couple of programs I want to remind people of. I've heard lately from administrators and people here at the county that we still have lots of opportunities to take advantage of the Kent County Small Business Recovery Program and the Kent County Nonprofit Organization Grant Fund Program. These are two funds that were created when Kent County received CARES Act money from the federal government. And the two programs that are meant to help small businesses and small nonprofit organizations to survive and thrive during this pandemic. And there are still resources available. So if you run a small business or a nonprofit, or you have a friend or a neighbor who is running a business or a nonprofit like that, please let them know about these programs. They're there to help. We've heard from some people that they're a little reluctant to take a handout, but that's not really what this is. This is really about investing in our community and making sure that these small businesses and nonprofits stay successful and don't close or struggle during this time of such difficulty for so many. So if you want more information about either of those programs, please go to accesskent.com, and you can find links there that'll tell you how to apply for those funds. And finally, I want to revisit a topic that I discussed a couple of weeks ago when I mentioned that mosquitoes are a concern at this point in the summertime, especially when we talk about West Nile virus and Eastern equine encephalitis, otherwise known as triple E. Unfortunately, I've been proven to be right here because we've now had a couple of cases of West Nile virus, and the state is reporting that statewide there have been 13 horses that have died because of triple E. These are both mosquito-borne illnesses that can create trouble for us, especially late in the summertime. So I'm sharing this information with you not because I want anyone to panic and not because I want people to stay indoors and to avoid the outside. Far from it. In fact, I love this time of year. My family and myself, we're going to be outside an awful lot in the coming days, enjoying the weather that we like so much in the fall, in fall activities. But I am sharing the information with you because these are things that are preventable. And we can do some pretty simple things in order to reduce our risk of getting West Nile virus or triple E. And it can be as simple as wearing repellent, especially repellent that contains DEET. Avoiding areas and times that you know are bad for mosquitoes, where there are lots of mosquitoes. Avoid those areas, avoid those times of day outside. And then take a walk around your property and look for small containers of water. Little things like soda cans or children's toys in the bushes, things that have water in them, serve as really good incubators for mosquitoes. We still have probably another month or two of mosquito season. We know the mosquitoes continue to breed and to reproduce during this time of year, so dumping those small containers of water out can help reduce the mosquito population around your home. So do those things. They're simple things. Don't panic. Please get outside. Please enjoy the outdoors. Be active. Those things are great for your health, but do the little things that can help reduce the risk of you or a loved one getting West Nile virus or triple E. Do those things and stay positive, stay heroic, and stay healthy, and I'll talk to you again next week. Thank you.